Good morning. Today is Thursday, September 17th. On August 24th, 3 weeks ago, we reported our first positive resident in one of our assisted living buildings in Ely, Minnesota. That person is thankfully recovered. That's the good news. The bad news is the virus somehow was transmitted to the memory care building, a separate building from the assisted living building. We have 3 buildings there, 2 assisted and 1 memory. It is with a very heavy heart that I report that we had 4 deaths over the weekend in the memory care building. This morning I was informed we had 3 more deaths yesterday, the last one at 11 o'clock last evening. As I reported previously, this virus was brought into the facility by a staff member who had been without symptoms, but had a high fever when reporting for her shift several weeks ago. Now we've had 7 deaths in the last 5 days. I've been taping these videos to you every week or so since the 1st of April, over 5 months ago. In each of those videos, I implored each and every one of you and your family to stay safe by practicing proper hand washing, using sanitizer, wearing masks, and other protective equipment, and perhaps most importantly, practicing distancing and staying away from large groups of people, which is generally defined as 10 or more. This deadly virus is transmitted only from person to person. We have seen situations recently where people are not practicing the above safety precautions. The recent protests, political rallies, weddings, funerals, and perhaps the worst case was a motorcycle gathering in Sturgis, South Dakota, where over 400,000 people congregated in that small town, not wearing masks, not using other protective equipment. Thousands of infections have now been spread across the United States, resulting in many deaths. Last week, coincidentally, the Minnesota Department of Health visited over 150 bars and restaurants and found that over half of them were not taking proper safety precautions. So if you happen to go into one of those bars or restaurants, there's a high probability you could contract the virus. The 7 residents we lost in Ely were all quite old and frail. Their bodies and immune systems were not strong enough to fight this virus, if indeed it was the virus. And several of them were so weak they stopped eating and taking fluids. We don't know if the virus was the cause of death or if it was just old age and their time had come. We have deaths all the time in our facilities, unfortunately, and all of these people were in their 80s and 90s. Family members in the community have been very supportive of our wonderful and caring staff in Ely. I was in Ely Tuesday along with 4 other locations, visiting with staff and residents and thanking them for their incredible commitment to our residents and communities and for delivering the outstanding care we are known for. We're still COVID-free in all our other locations, and we're working very, very hard to keep it that way. Many of you have asked about how my mother is doing. For those of you who haven't heard the situation, she's 97 and a half years old and weighs 72 pounds. She has been in a large nursing home near me here in the cities for the last 20 months, which was a result of 2 broken hips and a fractured shoulder. She's on hospice care, and has been for that time. This facility was horribly hit with the virus in May and June with many, many deaths. 60 to 70 deaths, we don't know for sure. My mother was tested positive on May 22nd and has exhibited 0 symptoms of the virus. She is healthy and doing okay, which is really a small miracle. Please stay safe and encourage your family members to do the same. Remember, we have ample amounts of personal protective equipment. All you have to do is ask for it. Thank you for all you do every day. God bless you and your families and all of our extended community. Thank you.